Construction is ready to begin on the new Austin State Hospital. The Texas Health and Human Services Commission says crews recently finished demolishing vacant buildings to make way for the new 240-bed psychiatric hospital. The state is working with Dell Medical School at UT Austin on the redesign. The new hospital is scheduled to open in June of 2023. The price tag, about $305 million. Texas lawmakers already approved more than $180 million. The remainder is pending legislative approval. One of the lawmakers who spearheaded those plans was State Senator Kirk Watson, a Democrat from Austin. He recently retired from public office, and filling his shoes is the newly minted State Senator Sarah Eckhardt. I spoke with her earlier about her plans in the upcoming session.
I wanted to start by asking how you plan to carry the baton and pick up some of the work that Senator Watson has left you.
Well, Senator Watson was such a champion in the area of healthcare generally, and also specifically in the area of mental health care and substance use disorder. So I'm grateful for all of his work and very much look forward to carrying it across the line.
Solving any problem like addressing mental health needs takes money, right? And Texas will be tightening the belt financially this year. What will you do to make sure that your priorities and the priorities of the new group of people that you're representing get access to the resources they need?
Well, of course, mental health care and healthcare generally takes money. But the good news is, I suppose it's good news and bad news, is not spending and investing appropriately in our community health actually costs more on the back end. So it's extremely important that we provide on the front end quality mental health care, substance use disorder care, behavioral health care, so that we don't have to invest in it in a far more costly and less effective way on the back end.
And how do we do that? I mean, it sounds great, but that takes all of the stars aligning and the people who are working on this to take those steps. How do you go about doing that?
Well, one great example is the redevelopment of the Austin State Hospital, as well as a couple of other of our mental health care facilities across the state. We don't have enough mental health care facilities across the state. Austin State Hospital will need an additional, already committed but not yet funded, $124 million for the finish out of the redevelopment. But when it's done, it will be a wonderful campus that anyone could walk into and say, hey, I need to know about or to access resources with regard to mental health care.
And more broadly, there are a lot of people in this state that are facing a lot of problems right now, whether it's because of the pandemic, healthcare related, financial. One of the big jobs that you'll be faced with in just a few days now is how to help those millions of people who need it. Where do you start? I mean, where do you start tackling that massive endeavor?
Well, where you start is through our local mental health authorities. Our local mental health authority is called Integral Care. Great organization. If you need information or you need to access services for mental health care, first place to start, your local mental health authority, Integral Care. So look them up and check them out. Then they can direct you to additional resources throughout the region for your specific issue. Austin Recovery is a great resource if you're struggling with a substance use disorder. NAMI Texas, wonderful organization. That's NAMI. National Association for Mental Illness. I have accessed them a lot for family members of mine who have issues, who don't even live in Texas. So again, I would strongly urge people to reach out to Integral Care, Austin Recovery, NAMI, or another organization like it to access resources.
And as we prepare for this next legislative session, what are some of the other things that are on your radar that you're working on?
In addition to upgrading our statewide system of mental health care facilities, we also need to more deeply invest in mental health care outside of a facility. The ability for your regular individual who is suffering to be able to reach out and get the kind of counseling and the services that they need. There are three big areas that we really need to concentrate on. First, we need to destigmatize reaching out to get services. And second, we also need to expand the amount of services that are available to people. I have unfortunately been privy to many instances where individuals who are highly resourced can't even get resources for mental health care. We need to expand those statewide services and get them out of the criminal justice context to the greatest extent possible. Right now, if an individual is suffering with mental illness and the only services that are available to them are through the criminal justice context, they're not eligible for Medicaid coverage for those services received in jail. That's a ridiculous system. First of all, we need broader coverage for Medicaid, but even for those who are currently covered, their services, their mental health care services in a criminal justice context are not eligible for Medicaid. So we really need to get folks who are suffering with mental illness out of the criminal justice context and into a healthcare context.
Senator Sarah Eckhardt, thank you so much for your time.
Thank you for yours.